Leukemia, lymphoma, brain cancer, and cancer of the bone are the most common cancers in children. They are most frequent in children from 0 to 18 years. Today our focus is on childhood cancer. How does it come about? As a parent or a caregiver, what are some of the symptoms that you should look out for? And generally, how does the treatment look like? Thank you for finding time to join us, and Health Nuggets starts now. In the year 2015, it was estimated by the World Health Organization that there were 397,000 new cases of childhood cancer worldwide, with 146,000 in Africa. However, only 224,000 were diagnosed, suggesting that 43% of childhood cancer were undiagnosed globally. In Kenya, 10 to 15% of all hospital admissions to the Kenyatta National Hospital pediatric wards were due to childhood cancer. Nearly all types of childhood cancers are curable. September is Childhood Cancer Awareness Month, and on Health Nuggets we join the world in creating awareness and showing support to parents, children and caregivers that are in this journey. And to help us in understanding childhood cancer is Dr. Robert Kimtai, a pediatric oncologist at KEMRI and the Kenyatta National Hospital. Thank you very much, Dr. for joining us once again on Health Nuggets.
Thank you very much, Ida, for giving me this opportunity to come and talk about childhood cancer during this Gold September.
Now, you've mentioned Gold September. Maybe you can just tell us a little bit about Gold September.
So Gold September is the month in which there's childhood cancer awareness which is created, and in this month specifically we want to raise awareness about childhood cancer, what is being done about it, and also to be able to also see how we can all participate in being able to support the childhood cancer awareness activities and the activities related to childhood cancer.
Okay, now going to our topic of discussion. Of course, in some way it differs from adulthood cancer, how it manifests and how it spreads. Maybe you can just tell us what childhood cancer is and some of the common cancers in children.
Indeed, thank you very much. I think really childhood cancer in many aspects is like adult cancer, in the sense that cancer as a disease itself is, what happens is that usually the normal cells in the body, just like the skin, the eyes, where the whole body is made up of cells, the normal cells, by some triggers which we have not fully understood yet, particularly in children, they lose control. The cells start to divide very quickly, and wherever they are dividing, they may either form lumps or crowd out the other normal cells. And one unique aspect about cancer is the ability to spread to other parts of the body as it advances. So in doing so, it uses the nutrition of the body and brings other problems which actually lead to death. So in children, the difference is that the type of cancers that we see in children are usually very aggressive. They spread very fast, and they actually lead to fatality or lead to death very quickly. However, paradoxically, that actually makes them much more curable than adult cancers, because the way the cancer drugs work, they work more on the dividing cells. So that the main difference between children and adults is that you will see a lot of blood cancers in children, and the types of organs that are affected are different, and even when you come to the biology, it's a bit different, and actually makes childhood cancer much more curable compared to the adults.
So is there a reason as to why it spreads faster in children?
The reason why it spreads and it's more aggressive in children is because basically the type of cells that are affected and the biology is quite different, because in adults what you tend to see is cancers which affect the linings of the body, like in the lungs, the lining of the lungs, like in the ovaries, the lining of the ovaries, like in the lining of the colon in adults. But in children, usually it's the blood cells, Usually it's organs like the kidneys, usually it's the organs which we call them adrenals, and some other parts of like the brain and all that. So in children, kind of the organs are different, the biology, I mean the type of cells affected are different. The ones in adults tend to be slow growing, and therefore they're less amenable to treatment and cure. So the adults usually tend to have lower cure rates compared to children. Yes.
Daktari, we will get back to that discussion, but coming up is Elizabeth Nyambura's story, whose son was diagnosed with bone cancer. Let's listen in to their journey.
Amekuwa akibattle osteosarcoma, bone cancer. Na safari yake ilianza, alikuwa anacheza mpira, akaanguka, akadislocate mkono. After kudislocate mkono, nikampeleka hospitali ya karibu na nyumbani. Then wakamwangalia, wakanirefer to another hospital. After hapo akatibiwa for 2 months. Wakarudi wakaniambia hii kesi yake wawezani nayo, wakanirefer Kijabe. Na Kijabe ndio wakamfanyia kitu inaitwa biopsy. Na biopsy venye ilitoka, wakaniambia akona kansa. Mimi kwangu nilishtuka sana kwa sababu mimi nasikianga watu wako na kansa, lakini sijaijipata mimi niko na mtu wangu wako na kansa. So nilishtuka sana. That's why ilifanya niende nikasik more opinions. Ndio nione kama atapona na mkono ibaki. Hakuwa naelewa, lakini kenye ilimshock sana ni vile daktari alimwambia uko na kansa na tunakukata mkono sai. Nikasik another opinion. Kusika another opinion, madaktari wengine wakaniambia it's treatable and curable. So nikaenda hospitali ingine, akaenda kafanyiwa kimo 3. Baada ya kufanyiwa kimo 3, wakasema tena afanyiwe amputation. Bado na mimi nikakataa kwa sababu sikuwa nataka mtoto wangu abaki bila mkono. So nikaseka another opinion ya Kenyatta. Nikaenda akafanyiwa chemotherapy 6 kutoka 2018 September to 2019 April. Kufanyiwa hizo kimo wakasema afanyiwe amputation tena. Bado mimi nikakataa. Nikasema atafanyiwa amputation. Nikaseka another opinion. Na kuseka another opinion nikaipata Kenyatta at private wing. Ndio akafanyiwa kitu inaitwa limb salvage. Akatolewa scapula na mkono ikabaki. Ilikuwa surgery ya 12 hours. Safari imekuwa mbaya sana, imekuwa tough.
So Daktari, what are some of the symptoms that a parent should look out for? Because I understand that the symptoms could mimic other diseases.
Yes, thank you. Indeed, in children, the symptoms that you tend to see can be what you see like in adults, like a lump. What they talked about, a lump growing bigger and bigger. Like for example, the foot can grow bigger and bigger. But the commonest childhood cancers actually are the blood cancers, which are leukemias and lymphomas. And these, unfortunately, like leukemias, do not have any sometimes do not have any outward manifestations, and are commonly mistaken for the common illnesses like malaria and repeated throat infections, because the way it affects blood is, first of all, you have less blood. That means you have anemia. It affects the cells which fight infections, therefore you get recurring infections. Then it also affects what you call the platelets, which helps the blood in clotting. So sometimes you find the child is bruising and bleeding much more easily, and those could signify leukemia. So one way they present is recurring infections, sometimes mistaken, like you said, it mimics other conditions. Other times it presents as a big mass, which, because it is in the internal organs, like in the kidneys, sometimes it's not apparent. Maybe when the mother is bathing the child is when they realize there's something not usual in the tummy. So when they do palpate and feel the tummy, then in that sense they're able to sense, no, there's not something unusual. When they come to the doctor, then it's through the imaging and specialized tests that we're able to diagnose. Then another way in which they come in is sometimes you've seen people having an injury, they fall, they get a fracture, and that fracture refuses to heal. So when that fracture refuses to heal and continues to grow, sometimes people link the events, but they're actually not linked. And actually it turns out to be cancers in sometimes. In the worst case, cancer can present as an emergency. The child may have a brain tumor, may come or may just be sick generally because of the cancers, especially leukemias, and they come in very sick, they come in coma, they come in as an emergency, and that is what we call an oncology or a cancer emergency. So the whole spectrum is there. They may come in as a walk-in, they may come in as a referral from another doctor who has noted concerning symptoms, they may come in as an emergency.
So when you talk of fractures, let's discuss a little bit about bone cancer. When the doctor says that that particular part that has been affected should be amputated, let's say the arm, should a parent seek for further advice from other doctors, or they should just go with what that doctor says? Thank you, Ida. I think that is one of the challenges that we face in oncology. Sometimes the treatments are not, can I call them, sometimes there's a refusal to accept some procedures, like somebody, the child may require the eye to be removed because there's a cancer in the eye. There may be the bone, there's amputation that needs to be done on the leg. So some of these are not socially acceptable sometimes. But there are mitigating measures in terms of, like, you can put an eyeball, an artificial eyeball. There are very good limbs nowadays that you can use. You can walk. Sometimes people may not even be able to tell that you don't have a leg. But coming back to the question about how we treat these cancers, there are pediatric cancer has advanced quite a lot. In the West, the cure rates actually are in excess of 80%, going towards 85% for all the children. And this has come about through the use of what we call very standardized protocols. And those standardized protocols have been established for different diseases. For example, the blood cancers, we use chemotherapy, which usually follows a very strict schedule. And that strict schedule has got time intervals where these drugs are given, different phases, which have achieved different things, and up to the end of the treatment. For what we call solid cancers, like the bone, like the other organs, usually we start with chemotherapy, normally to try to shrink, because ultimately this will require a surgery. So for the surgeon, it helps the surgeon to make the blood flow less in that area, so that when they come to operating it, it becomes easier. So for solid cancers, we tend to start with chemotherapy, shrink the mass, make it more amenable to surgery, and then surgeon comes in. Like you've talked about the leg, for instance, they need to amputate it. If it's in the eye, sometimes you need to remove the eye, what we call the enucleation. If it's a kidney, we may need to remove that kidney. So surgery really comes in when it's a solid, what we call a solid tumor. And after surgery, because the surgery will remove the bulk or everything, then usually we boost this with radiotherapy, and then after radiotherapy we continue with chemotherapy, and that chemotherapy continues until the end of treatment. Most treatments for solid tumors will last in the range of 4 months to 6 months. In the leukemias, what we call acute leukemias, some types will go really up to 2 years. And in the leukemias, many times, if they're much more difficult ones to treat, then they may need things like bone marrow transplants, and that is why we are people needing to go to bone marrow transplants in some specific instances, and especially when the cancer comes back, which is unfortunately the case sometimes. And of course, as you mentioned, the survival rates of children are higher compared to adults. True. So this is kind of most true for the high-income countries. So when you're talking about countries like America, Europe, and countries which are really high income, the rates of cure of childhood cancer is really impressive and superb. And that has happened slowly through research over many years, and through just developing, almost every patient goes into a research protocol there. Unfortunately, this is not true in Africa. In Africa, WHO estimates that in some countries the cure rates may be as low as 20%. The reasons for why we have these low cure rates are sometimes things like lack of drugs, treatment abandonment. There's a lot of social taboo regarding these long treatments, and people not believing that cancer is curable, or not believing that it's actually even a cancer, and so many other things which are surrounding that.
we do lack infrastructure sometimes. We have excellent imaging capability. When you go to level 5 hospitals, we have even MRIs, but we don't have, we generally lack in terms of laboratory pathology support. So for many times we are still using what we call histology, which is basically looking at the microscope and looking at the cells. But the more expensive and available techniques in the West, like immunohistochemistry, like cytogenetics, those are those which really give you like the fingerprint of the cancer itself. Personalized kind of cancer treatment is not available, and we need all this together, put together, so that you can get high cure rates. Other things which also contribute to lack of, to the low outcomes, because I said we need standardized protocols. We use standardized protocols, and failure to use those standardized protocols means people, when they go home, they fail to come on time. So the protocols kind of are affected. Then another critical component which we also need is supportive care, which is blood support, because during the course of cancer treatment you need blood and you need platelets, because the chemotherapy itself affects those counts. Then another crucial area which also we need is counseling, because it's a long journey. It's sometimes what you can call a devastating diagnosis, and you don't expect that a child can have cancer. So we really need usually to support the family, the mothers, the siblings around. It really affects much more than the child, and it affects many other people. So all these things together, it's done through a multidisciplinary team, and usually the oncologist is just one. There's usually the medical doctors, the nurses, the counselors, the radiologists, the pathologists, the surgeons, and many other allied teams who support this. And so it's a really multidisciplinary effort. So you'll find that because of the need for very specialized skilled staff, the high infrastructure in terms of imaging and all that, because of the high techniques that we need in terms of the laboratory and all that, there are only very few places that can actually treat.
Dr. Before we go to the diagnosis of childhood cancer, there's the issue of whether cancer in children is genetically inherited.
So cancers in children, like you mentioned, I've got several causes, and whether it's in adults or children, we know that there's a genetic component, and we know there's an environmental component. In adults, we attribute a lot of things to the environmental component, which I mean by things like smoking, alcohol, having lived in the world for a long time, they have been exposed to environmental issues. But in children, they have only been in the world for a very short time. Of course, they don't smoke, they don't drink, so they're not exposed to more of these environmental factors. So the genetic factors actually do play what we think is a significant role, but it's really usually very difficult to pinpoint and say what is the cause of cancer in a child, and therefore really no one can be blamed. Sometimes people think that we can blame the genetics and blame this and blame, but usually you cannot blame anybody because a child has had cancer. It's just something which is bad happens to good people.
Well, in creating awareness about childhood cancer, we can do a lot as a society. Coming up next is Esther Wangoi Ndongo, a program officer at Hope and Courage International.
I know majority of the people do not know about this, and also there is a lot of misinformation about cancer. There are people in the society who think that there is no childhood cancer, but why we are here today is to inform you that childhood cancer is real. There is no one kid who deserves to die because of cancer, because one thing about it is that when it's detected early enough, it is treatable. This year, having the issue of coronavirus, we are not able to do the walks and the talks like we do physically, and that is why we are trying to do this on TV and online. So the campaign is out there. You will be seeing a lot of gold color. I'm sure majority of people don't know what gold means and what association it has with children battling cancer. It was in the year 1997 that some parents came together and they decided to pick gold as the ribbon for childhood cancer, because children are golden, you know. It is a precious thing to be a child, and you know gold is also very precious. So this month, September, just like you see many people put on the pink ribbons during the month of October, the breast cancer awareness, also come out and do gold. just to show you support. When a child is diagnosed with cancer, the burden is usually very huge. It's not only to the child, but also to the parent, because they do not know how to relate with this child anymore. Because how do you even start explaining to your child that they are battling a life-threatening condition like cancer? But with the support that as the society can give to them, it will help lessen the burden, and it will support this child in fighting, because we call them warriors. Because cancer is, when a child is diagnosed with cancer, they become like warriors in a battlefield. They fight this disease and they win. By the way, let me disseminate the information that cancer is not treatable. Cancer is treatable. Many kids, they get cured. And some of the things you can do as a society, maybe you can offer to take the parent, to accompany the parent to the hospital. When you go to the hospital, there are so many things that entails cancer treatment. Like there are tests to be done. You have to run up and down, giving some information and documentations. So you can accompany the parent to the hospital, just to help them feel like someone cares about them. You can also offer to stay with the children, other children at home, when maybe the mom is the one who is getting admitted with the child in hospital, and it's usually for a long period of time. So offer to stay with the other kids. You can offer to be attending school meetings for the other children. You can also offer to give your assistance in terms of resources. We know that in Kenya, majority of the families are not even able to make ends meet. So once they have such a case, they are not even able to pay for NHIF. Just give something to pay for the NHIF cards for these children. And also, you can offer to just join in campaign, volunteer in an organization, just learn. If you're a young person, you can learn and also give yourself to educate others. Cancer is not witchcraft. No. Cancer is just a condition that I believe the doctor is going to explain to you what cancer is. But what I mean is that you should also be interested to learn about it, so that you can also offer to educate others, like those people in the village who do not have access to internet and all that.
As we mark the Gold September, what's your call to parents, to children, to caregivers of children that are living with cancer, and broadly to the society?
Yes, so during this month, I think the biggest call is for us to be aware about childhood cancer, show the love and support to anybody who is affected by cancer, because like I said, it does not just affect one individual person, it affects the whole family and also the community. And we want to show that we really care and want to attain the high cure rates that we see in the West. We are, fortunately, in Kenya, we are talking maybe of 40%, and we want to reach that 80 and 85%. That is the first one. The second one is during this month, anything that you can do as an individual, as a person, whether it's a donation, whether it is going to visit the children, going to visit the hospitals, to support and really participate, do whatever you can. A lot of times people also wait for Christmas and bring these gifts, but there's play therapy, even just sitting down and playing with the children, find a way to support them. The third one is because we need blood support in the hospital. If you can donate blood, that is really going to be very supportive to children. Come to the hospitals, because we need blood, we need platelets, and these are really critical to survival of the children, because they are leaving the next day sometimes because of the chemotherapy and all this. Their counts may come down, and they need the support, and we usually frequently have a shortage of blood, and I think that is one of the big things that you can do. I think my final call is with everybody working in this sector, we work collaboratively, so that through research and through giving treatment, we can really reach these high levels. WHO wants us to reach 60% cure rates, and I think our ambition is to push it beyond 60%.
Having walked the journey with parents and families that have got kids who are diagnosed with cancer, I would say that it's a huge burden. It drains them financially, it drains them emotionally. If cancer is detected early enough, it's curable. Do not ignore those symptoms that your child is talking about, because that is also one of the greatest challenges we have. By the time the kids are being diagnosed, they are probably stage 3, stage 4, which becomes very difficult. So if your child is talking about some symptoms, stop going to the over-the-counter to buy drugs. Take them to hospital and let the doctors diagnose this disease early enough. Also in terms of feeding, stop giving your children just junk food only. Even if we're told that kids' stomach stretches to an endless point when it comes to junk, please, you are a parent, give them natural food which is healthy to them, and it will help them to stay strong and healthy, and you will avoid some of these life-threatening conditions like cancer.
Mimi naweza wahimiza, si ati daktari akikwambia mtoto ako na kansa ati ndio mwisho ya huo mtoto. Bado huo mtoto ako na maisha ingine, na wewe kama ndio huo mtoto aweze kupigana na hii vita, wewe kama mzazi ndio unafaa ukuwe strong kuliko huo mtoto, ndio umpe nguvu ndio aweze kupigana nayo na umshow more love.
Childhood cancer statistics proves to be a wake-up call to creating awareness and showing support to parents, caregivers and children that are in this journey. As we've heard from Daktari, as parents and caregivers, we should have that extra suspicion, and together we will bring these numbers down, for there is hope. That is all we had for you from Health Nuggets, and as we've heard, it's Goal September, so let's continue creating awareness about childhood cancer, and together we are going to win. My name is Aida Munzati, and as always, your health matters.